Good afternoon, everybody. My name is Ashok Gadgil. I am the Director of the Environmental Energy Technologies Division. And it's my great pleasure to welcome you all to this seminar on a new effort that the lab as a whole has launched. It's called the LBNL Institute for Globally Transformative Technologies, pronounced LIGTT. And we already have substantial support from the lab's directorate, which has allowed us to go out and seek one of the best persons we could find to lead this as an executive director, and that's going to be Dr. Shashi Buluswar. And let me introduce him with a little bit of bio because he's coming to the LBL from outside. He hasn't been at LBL for some time, right? Shashi has a doctorate in robotics from University of Massachusetts, and then he taught in the computer science department at Northwestern. He has an MBA from the Kellogg School at Northwestern, and then experience with McKinsey because he just said, this is what I want to do. Beyond that, he has been advising out of McKinsey. There is a spin-off group called Dalberg Associates, and he's been advising nonprofits and multilateral institutions, primarily working in disaster recovery, in refugee situations, post-conflict situations, and developing world in terms of how poverty can be alleviated, which were the goals of these multilateral aid agencies and of nonprofits. So he has worked with the UN Peacekeeping Department to restructure global operations, with Bill and Melinda Gates Foundation to launch large-scale agricultural development programs in Africa and India, with the US government in post-conflict development in Afghanistan, with several multinational corporations to improve their social responsibility agendas, and with dozens of NGOs fighting for human rights, health, education, and economic empowerment. And in all this, he has traveled to more than 70 countries, spent time there, boots on the ground. In addition to all of this, he's personally very passionate about human rights and has worked on the human rights issues on his own, often taking great personal risks in doing so. So without further ado, I would like to welcome Shashi.
Thank you, Ashok. Always a tough act to follow. And Ashok, thank you for everything you've done so far with Darfur Stoves, with all the other humanitarian projects, and for laying the foundation for what we're hoping to do here. I'd also like to thank a few other individuals, the leadership at the lab, Paul, Horst, Don DePaulo, and the team that worked tirelessly over the last year to put this together and get this off the ground. Doug Davenport, Reshma Singh, Roger Sathri, Marcy, and Susan Addy, who's not here with us today. Also like to thank my colleagues from Dalberg, Bruce Au, Chris Denny Brown, and Shubarna Mitra. Again, they're all checking in from various parts of the world for this, and Melissa Summers for putting this together. What we'd like to do today is, first of all, talk about the Institute. And the first most important question we need to address is, how is LIGTT pronounced? Shockingly, LIGTT is pronounced light, and there's been a raging debate that I'd like to put to rest right now. So let's then talk about the vision. What is it we're hoping to do? What's our mandate? What types of issues are we hoping to take on? And then, most importantly, for the scientists and engineers here from LBL, how can we collectively work together to achieve this mandate? We'll have a panel discussion about that, and then we'll talk about what the next few months look like. There's a lot of work to be done, and we'll look at it a few months at a time. So let's start by looking at this wonderful chart. The horizontal axis on this chart is the Human Development Index, which the UN puts together. It's a combination of indicators from economic development, from health, from education, and countries are ranked from 1 to 194. I guess that's the number of countries in the world today. The vertical axis is the ecological footprint, which is carbon plus water plus land usage. And what this graph tells us is that the countries that are more developed tend to have a larger ecological footprint. So if you look at the dots over there, you have the US proudly leading the charge on the top right. A couple of the Arab countries are actually, for their population size, they have a pretty big footprint. And then you start looking at the bottom left. Anything that's 2 or below is a pretty healthy footprint, but at the same time, everything that's the left of that red line over there is not looking so good with respect to human development. So India, you see over there, and Niger, which is one of the least developed countries. So the problem has been twofold. First of all, you have a whole lot of countries that seem to not get past this barrier. And then those that have broken free, how do they get those countries in the green zone past the vertical line in the middle? So that will be the focus of our discussion today. So what does it mean to have a low human development index? To begin with, you live 30 years less than your counterparts in developed countries. So what this is if you take the Human Development Index and group the countries into deciles, the bottom decile, which is the cluster of least developed countries, on average, people live to about 50. At the same time, if you look at poverty, more than half the people live below $1.25 a day. But beyond statistics, what does that mean? You drink water with human waste, and you get diarrheal diseases, you die. And the medical care available to you is medieval at best. Right? There are no hospitals, no clinics, and you have to make do with individuals of goodwill coming to come and help you. If you are in need of medical help, the facilities are far from sterile. Chances are you'll catch more diseases going to some of these clinics than you went in with. There's a project we'll talk about later on today where women who give delivery, who give birth at night, are at substantially greater risk of dying because of lack of light. So there are a couple of folks here in this room who've launched a really interesting project on lighting for maternal care. But that's the status quo. It is these handheld lamps using which clinicians are performing medical operations. And then the homes are leaky. They can break. If it rains, there's water. That's what it means to be living in a low HDI country. And then if you're working, you have to carry the weight of a mule on a bicycle at best. If you're a farmer, the best you have with respect to irrigation is foot pumps. Right? And that's what you have to contend with to break past the cycle of poverty. Now, the challenge is you can rattle off a list of 50. It's not clear where you start. The question for us here at the Institute is, where do you start? And the starting point is with populations. We'll focus on 2 target populations, the urban poor and then refugees and nomadic populations. Granted, there is a very large population of rural poor, so we're not ignoring that, but we're focusing largely on the urban poor and refugee and nomadic populations. Why is that? Well, if you look at this graph, what it shows us is the projections of population growth in 3 groups of countries: industrialized, emerging or developing, and then the least developed. What you see is that the red circles are to the right of the blue circles, which means that populations are moving to the cities. What you also see is that, particularly for the poorest countries, there is a youth bulge, which means that an overwhelming portion of the population over time will live in cities. And the thing about urban poverty, poverty has always been addressed as a rural development issue. Agricultural development has been the cornerstone of most foreign aid and development programs. But we're facing a really interesting challenge now, the new urban poverty. And here's what it means. If you take the population of a country and you divide it into income brackets, so take actually the average city in Eastern Europe, and you look at the population pyramid, and you say how many people earn more than $3,000 a day, how many earn about $3,000, $2,500, and so on and so forth. This is what the population pyramid looks like. There is an economic trickle down. So whatever that middle class spends, a portion of it drops down, and the aggregate income of the next bracket is 5% of that, and then more trickles down. So the people earning $2,500 a year, their aggregate income is 85% of the bucket above that, and then 65% above the bucket in the bucket above that, and so on and so forth. Point being that if you believe in trickle-down economics, and not all of us do, there you can see a trickle-down effect where you have the urban poor serving the urban middle class and living on that. Now, if you look at the population pyramid of the average African city, here's what it looks like. The bulge is at the very bottom. And what that means is this. If you do the math, there is no trickle-down. Right? If you look at that red box over there simply isn't enough money trickling down to solve poverty. What that means is that the economic solutions have to be self-contained over there. There has to be the self-contained economy in urban slums. That no one's found a solution for. And so how do you solve that problem? Given that this is what you're dealing with. You're dealing with manual labor. You're dealing with conditions that people die because there isn't food, there isn't clean water, there's dirt everywhere. So that is the challenge we're trying to take on. And the question then is, you've all seen pictures from aid agencies fundraising, showing you these statistics in these pictures, right? So why is this relevant to this crowd here at LBL? If we step back for a moment and think about what the pillars, the cornerstones of development have been and industrialization, it comes down to four things. Right? First of all, you needed a large base of very talented people who are engineers, doctors, attorneys, policymakers, and they built institutions. Right? They wrote law. They built universities. And in addition to that, you needed infrastructure, which took, again, hundreds of years to build. Most of the countries we're talking about don't have these three things. There is a fourth pillar, which is scientific innovations. And remember that everything that the industrial world has accomplished has been on the back of these huge breakthroughs that sometimes help us skip generational problems like huge diseases. Human capital takes a very long time to build. Primary through, depending on what degree you want, a doctorate takes a very long time. And to build a university system, a set of schools that can actually graduate enough people to get you past that pipeline takes a very, very long time. Institutions also take a very long time to build policy, legislative processes. Those take generations to build. Infrastructure is also difficult. The one thing we can do that'll give us a step change is innovation. Granted, it's not, it doesn't solve everything, but this is the one lever we have where we can make a generational change with a significant breakthrough. We've seen that in medicine, we've seen that in agriculture. And so that's why this conversation is relevant to the Lawrence Berkeley National Lab. There are a number of technologies that are emerging that seem to be making headway in this context. So solar, we're seeing interesting breakthroughs. We're seeing really interesting appliances that operate with less energy than before. You have mobile phones, again, changing the game in small ways. There is also a lot of progress has been made in health and sanitation. Now, not a huge amount of progress, but there's one really interesting set of commonalities that these technologies have. First of all, they're distributed. They do not require infrastructure, which is great because infrastructure, the dependency is huge for if you try to build a building that's connected to the grid, it's a very different conversation than if you try to build something that's hooked up to a solar system. They do offer the chance to leapfrog When I was young in India, it would be cause for a neighborhood celebration when we got a telephone in the house because it was a 3-year waiting process. And when we got the telephone line, everyone would come and check it out. And they would make phone calls, and then it would stop working. But mobile phones change all that. Right? Now you can go to a place like Darfur, and people have mobile phones. In fact, and I don't have scientific data to back this up, the phone reception in Darfur is better than in the Bay Area. And then these are, in principle, scalable, meaning that if it doesn't cost a whole lot, you can actually reach a lot of people without the same level of investment. So all sounds wonderful. And what does this mean? It means that the challenge it allows us possibly to overcome is avoiding this curve, right? Development does not necessarily have to be accompanied by a large ecological footprint. That's a very abstract concept. In fact, the risk is less that, more something like this, where you have countries that aren't necessarily breaking through the poverty barrier, but because of exploitation of the resources, because of pollution, because of degradation of water and land resources, you're actually seeing the ecological footprint get worse before the economy improves. In many ways, the problems we're trying to solve will look slightly different. So these countries over here, it'll take a miracle to frankly get them there, right? So it's really about these smaller step changes, if you will, right? So the Nigers and the Democratic Republic of Congos of the world, if we can achieve huge breakthroughs, they'll still change a little bit, right? They'll move from a 0.2 on the HDI to a 0.4. And the countries here, ideally we can get them on a slightly less steep curve. And then there are the Indias and the Chinas where they are at serious risk of exploding, ecologically speaking. And there's a lot of work to be done in terms of mitigation of the ecological footprint. So the challenges and the solutions look very different depending on the country you're talking about. So, and the other part of this is, in a country like the US, particularly in a place like the Bay Area, there is no shortage of conversation about climate change. It is obviously a huge problem. But frankly, in many places, particularly if you look at the Nigers of the world, it's not about climate change. Right? It's about, it is unlikely they'll ever get to a point where there'll be enough consumption to make a dent in this. It's really about not having to rely on institutions and infrastructure and things of that nature, and moving to the right. So these technologies, these breakthroughs are partly about the question of climate change, but also about empowerment and development, even absent the conversation about ecological footprint. Now, if you ask someone what are the 5 technologies that are really important, what are the technologies that are really important to developing countries, you get the same list of 5. You get solar, mobile, so on and so forth. What nobody knows is that list 5 long or is it 1,000 long? Right? It's because chances are most of these breakthroughs are still undiscovered. We know what the problems are barely. We don't know what the solutions are yet. And so if you look at this funnel, and you divide that into 3 rough groups: discovery, which means that it's still in the labs; development, which is it's gone from the labs to engineers working and making a real product; and deployment, which is people are starting to use it. Mobile phones are maybe a couple of other technologies, but mobile phones are sort of one quintessential example of a technology that's out there deployed at scale. Then you have a whole bunch of things in the development phase. You see cook stoves, you see computing is getting more and more inexpensive, and a few others. But then there's this vast list of, I don't even call them technologies, really problems, right, that require solutions. Mm-hmm. Not all these problems have technology solutions. Right? Some of them have nothing to do with technology. Some have solutions that are enabled by technology, and yet others have solutions that are led by technology. So there's a lot of work to be done in really studying these problems, understanding what they are, in understanding the relevance of technology, and then starting the process of discovery and moving them up the funnel. That's where the Light Institute comes in. So if you think of all the wonderful stuff that's developed in the industrialized countries and taking them to the developing world, it is a long process. And we're hoping to stay involved throughout the life cycle. And here's how we're hoping to do it. First of all, going back to what I just said, it's really important to understand the needs and understand the relevance of technology in addressing these needs. And we'll start with, as I said, the urban poor and refugee populations, and try and unpack what is it those challenges are. That's where the scientists and engineers at LBL come in. There's $1 billion, billions of dollars of research here, right? And no one knows how applicable, how relevant that is to development. Some of it won't be, some of it may be. But a part of this adventure is to take that for a spin and see what's there. Right? And I will not be surprised if there are some shocking results out there, things that the scientists don't think have any relevance to development. I'll bet we'll find a few gems out there. Which is why there's a cloud, because we don't know yet. For sure, there are some things that are relevant, but it'll be really interesting to figure out what else there is out there. Then we'll work with the network of institutions around the world, be the universities, NGOs, other research labs, engineering companies, and work with them to make these things usable products, inexpensive products, robust products. And then work with the right organizations that understand how to make this work for the populations that need them. There is no shortage of hammers looking for nails, and that is the problem we have to avoid. It's not simply a matter of developing wonderful technologies and tossing them over the fence. There has to be a lot of involvement from end to end. Obviously, we cannot do everything. The secret to our success will lie in having the right set of partners who we can work with over time to take it from one end to the other. And there will be a lot of failures along the way. So we have to continuously learn from these failures and figure out what to do better the next time. There is a lot, as I said, going on here. So far, and I'm very new. In fact, I've formally not quite started yet. And if you ask me what the various divisions in LBNL are, I can't even tell you how many there are. And I think I copied this from the website, so I think this is the right list. But there's a lot going on here. This initiative is it's a perfect fit with the Carbon Cycle 2.0 initiative that's going on. And part of what we have to do, as I said, is explore what lies beneath the curtain in each of these divisions. This is not a new thing to LBL. Individuals working nights and weekends have actually done really interesting things. Evan's done some really interesting work in lighting. Ashok, well, we can say a lot about Ashok. Among the things he's done is UV water purification. Robert's done work on cook stoves, and Francis, who we'll hear from very soon, has done really interesting work with Weak Air Solar. That's the maternal health device NGO that I was talking about. So how do we work together? So here's the thinking so far. What we'll do for our part as the LIGHTT team, over the next few months, and frankly on a continuous basis, we'll go spend a lot of time in refugee camps and urban slums, and we will do our best to document. We will videotape, we will interview, we will collect all types of useful data and information, and we'll bring it here. Every couple of months, we'll block off a half a day, and we'll do a day in the life of session. So we will look at one aspect of the life of one individual in living in these conditions, and we'll collectively talk about it. Engineers, scientists, we'll bring in people from the university, social scientists, and figure out how to solve one small problem at a time. We'll bring in experts and stories from individuals who've done really interesting things. So one person in the room is Dr. Laura Stackel, who's done really good work in the maternal health example I was talking about. So we'll have other individuals that come and talk about their experience, what's worked, what hasn't worked, and what they see as the next problem to solve. I will personally make myself as available as anybody wants. Coffee sessions, I have a feeling I will be over-caffeinated for the next many years, but would love to talk to each one of you and see what you have, what you're working on, even if you don't think it's relevant. We'll put together teams of individuals working across areas, people who know populations, people who study these populations, people who are scientists, people who can build stuff. And we'll have an online mechanism which doesn't exist yet. So we'll have something called ideas@light.org. Right now, if you send an email message to that, it'll bounce back because it doesn't exist yet. But we'll create this mechanism where if you have an idea, you can post it there, and we'll figure out how to take it from that to a real concrete project. And for your part, there are a lot of interesting ideas that the scientists and engineers here have. My inbox is full of really interesting ideas already, and over the next couple of months, I'll working closely with our team, parse through these and see what's there. But the questions to ask, 3 questions really, and it's all about whether it's a hammer looking for a nail. Is it addressing a significant problem? Is it addressing a very large number of people, 10 million? Right? And is it feasible? Is it something that can actually get to the market 5 to 7 years from now? And the last bullet I say with great trepidation to a bunch of brilliant scientists, no idea is too crazy. But this is not, the Institute is not this isolated little thing on campus here. It's all of us working together. And the only way these problems will get solved is if we bring the weight of the lab behind us. What do the next few months look like? So we have a vision so far, but we don't have what we'd call a strategy yet. And what a strategy looks like is which countries, specifically what things will we do. That'll take some thinking. So next couple of months we'll do that. We are very grateful for the seed funding that Paul and the lab leadership have given us, but there's a lot more fundraising to be done, so we have to go talk to the funders. In May, probably in the first week of May, stay tuned, we'll have an external-facing event, and that'll be the formal external-facing launch. Then we'll begin this exercise of mapping the needs, and this is it sounds easy, but it's actually remarkably hard, because when you talk to an expert about what the needs are, you get a smorgasbord, but what you don't get is a methodical assessment of these needs and the prioritization, which can be addressed sooner versus later, and then also start the process of understanding what's going on in all the divisions over here. So our work is cut out for us, not just in the next few months, but the next few years. And the truth is, frankly, we can do one-off technologies, right? Frankly, given the intellectual horsepower that lies within a 2-mile radius of this room, we should be able to do the one-off stuff in our sleep. That's not a challenge. The question is, can we systematically and methodically identify the most important problems and knock them off one at a time? Even more interesting, can we actually work with the right organizations and institutions and set the global agenda on this? That's the challenge we have to take on. It is an enormous challenge, but that needs to be our ambition. So I'm looking forward to working with all of you over the next few years to make this happen. Thank you. And what I'll do now is invite Francis Rubinstein to talk about his experience and how he found it to be a life-altering one.
Excellent. Thank you. Okay. So this is a rather sobering statistic to start off with. This is 1 in 22. So 1 in 22. A woman in sub-Saharan Africa, her chances of dying as a result of maternal death is 1 in 22. That compares to 1 in 8,000 for what we see in developed countries. What does 1 in 22 mean? Well, essentially that means that we could take a group of 15 of these women, we would know with better than 50-50 probability that one of them is going to die as a result of giving birth. That's an appalling statistic to think about. Add to that the fact that the infant mortality rate is 94 out of 1,000, which is pretty much close to 1 out of 10. So 1 out of 10 babies also don't make it. That's as I would say, is quite an appalling statistic to look at. Last year, Dr. Laura Stachel, shown here, approached me and asked whether I could give her some help in helping to develop better LED lights. So you can see that she's holding 2 of them there. This is a training session that she was giving in Nigeria, and what she's standing over there is the WeCare Solar Suitcase, which is effectively a rechargeable power supply, which can be used in women's health clinics. And so Laura asked me for my help in developing a better light for the application that they had there. For me, this is a pretty unusual problem. This is not the kind of problem that I typically have worked with in the lab here in my 30-plus years experience. Let me take you over to the UK. This is a modern hospital in the UK. You'll notice there that you have lighting over each one of the beds. You got a beautiful view out to the outside. It turns out that the lighting there, actually the color temperature varies as the time of day changes between blue and yellow. I mean, this is like, you'd almost want to be sick to be in a place like this. So this is the kind of thing that I'm sort of used to, and I love this kind of stuff. I love the changing the type of light that people and that people would have when they're recovering from surgery and so forth. And we do have some evidence that people actually do get healed faster when they're in a better environment. But as you can see, this is the level of expectation here about the level of energy service is completely different from the kinds of stuff that Sashi was talking about that happens in Africa and in the developing world. Here, the expectation is that you have 50-foot candles or 500 lux at the command of just throwing a switch, and you've got that, and it's there. And that's the kind of problem that I have been spending much of my career trying to solve, and I enjoy solving those problems. But it's not exactly world-shaking. Let me now take you to, this is now a clinic, I believe, in Nigeria here, and it's a little hard to see there, which is intentional. There's a woman there with a little kerosene lamp there. There's a power failure, so often they have to use kerosene lamps. What you can't see is behind her are 12 patients, women and newborns, which you can't see, which she's in charge of taking care of. And as you can see, you can't see them, she can't see them either. That's a huge, huge problem. So in order to try to solve this problem, what WeCare Solar has come up with, and I think I saw Corinna out there also, Corinna Garbisi, who's also on the board of directors for WeCare Solar. So this is a quick look at what the solar suitcase looks like. And for our point here, you'll see the lamps that are up in the upper right-hand corner. And the lower left-hand corner, you see the headlamps. And it turns out that these headlamps are extremely useful when you're trying to do emergency surgery or all sorts of things, even just simply doing bookkeeping and so forth. Those headlamps are like gold. Trouble is with these headlights is they're not super reliable. And I actually brought one of them with me here to show you. And actually, I grabbed one, and amazingly enough, the switch didn't work. And it gives you an idea. These things are not necessarily really all that reliable. And when you're out there in the middle of nowhere, if a small part breaks, you throw the thing away. Now, I started looking at specifically what is the task that a nurse has to perform. Well, she'll have one of these headlights on, which will give her some light. Ideally, you want to put light in a certain disk, but at enough intensity so that the nurse or the surgeon is able to do their work properly. Now, the trouble is, this is likely to be the only light source that's going to be there. And I'll turn this one on, and you can see it's not super bright, but you do close enough. You'll get enough of a beam to actually see what's going on. It's likely to be the only light source that they're going to have when they're doing the different types of tasks that they have there. And there are a lot of these commercially available lamps out there. And one of the things we found is that they have multiple modes in them. So this is a darker mode, a lighter mode. You get different modes, and each one consumes a different amount of electricity. And so we wanted to pay some real attention to what were those different modes and how could we actually characterize them. And we did some work on this last year. Got a little bit of money from the division, and we managed to do some measurements on some of the different candidate lights that the We Care Solar folks were looking at. And this is the one that actually we tend to like best. Look at the left hand, you can see actually the beam of the headlamp. You can actually see what that beam looks like. It's really important. On the upper right there is a surface plot which shows you how the light falls off away from the center. And you'll notice that it's fairly soft shoulders, it looks like it's a fairly steep divide, but it's actually a relatively slow divide. And then we can do a little bit of MATLAB magic there to extract out from that image there on the left, to extract out what the illuminance is and what the candle power is in a bunch of different types of conditions. And then from that information, we're able to say, okay, if I had this headlamp at this distance, this is how much illumination they would actually get. So we looked at these headlights, and it turned out this one is actually better than another one where you'll see a much sharper pattern there, and you'd think, a sharp pattern would be the way to go. It turns out it's not the way to go. You don't want to have one of these things on. You don't want to be sitting there hunting with your head as you're trying to do work. You want a broad beam, and we managed to show that in the work that we were doing. And I was actually very excited about this, partly because this is actually a new method that we've actually worked out using high dynamic range photometry combined with photogrammetry techniques. And using those techniques, we actually managed to solve a pretty interesting problem. And as I indicated, these lights have multiple modes, and we want to be able to get the information for each one of those modes. And with this method, we can rapidly characterize the energy service. So it turns out that there was a really kind of a neat engineering problem wrapped up in this, in this as well. Now, I'll be, it's one of the sort of the testimonials that really sort of grabbed my attention was that one of the doctors who had access to the solar suitcase in the Congo, he used the solar suitcase and the lights for an outbreak of cholera. And he told the We Care Solar folks that it transformed his ability to care for the patients, and that none of the mothers, fathers, and children with cholera died. He said that usually 80% of the deaths occur at night, but that with the solar suitcase and with the lighting, they could monitor and treat patients through the night. That's an incredible inspiration to me, the fact that to think that some of the work that I might do might actually really save lives, and that's an incredible incentive. And frankly, probably the humanitarian aspects would probably be enough to really capture my interest to work on this problem. But I was delighted to find that there was actually a fairly sweet little engineering problem wrapped up inside all of this. So not only did I have a good humanitarian problem to work on, but actually had enough engineering in it to really kind of grab my attention and really really grab my intellectual attention. Now, this is not sort of deep science. This is not the search for the Higgs boson. I'm not won't delude you on that. But if it's true that, as Sheldon Cooper of the Big Bang Theory said, that engineering is merely physics's slow younger brother, that's an interesting quote, I would argue that it is exactly the kind of targeted slow engineering that is needed to solve these kinds of problems. And I'm just going to end up on just this is another sort of testimonial. This is some folks who've just gotten the solar suitcase, and you can see those are not pretend smiles on their faces. They're delighted to have this new capability. And you'll notice there on the right, this is a training session where some of the nurses and the other folks who work in these clinicians are being given a training session on how to use the solar suitcase. And look at all the kids looking in the inside, fascinated by it. That's not the kind of thing that I'm used to seeing in the kind of work that I do in the developed world. So that proves to be a real incentive for me, and I really appreciate both the We Care Solar folks for giving me the opportunity to work on this, as well as the New Light Institute, which I think is going to be a wonderful way for us researchers to be able to put our attention on these problems, which really need a fierce urgency. Thank you very much.
Have a short panel discussion, Q&A, and we talk about the lab community can get involved in this. So Ashok, Reshma, Roger, and Francis.
I'd like to hear your thoughts on what the model for staffing these efforts will be. Obviously, there's the core people up there, but is this all to be 100% volunteer hours effort, or will you be building up a staff of dedicated people?
I can take a crack at that. So in fact, when Ashok and I first spoke about this, that's exactly what he said. We can't solve this nights and weekends. These are serious problems and it takes serious effort. So we'll have a small team dedicated at the Institute. More importantly, we'll have a network of very powerful organizations all over the world. And we'll utilize their staff, but these will be paid full-time staff. Now, it doesn't all have to be people here. But we'll raise funds so that we can employ professionals and do this the right way. Ashok, do you want to add to that?
Sure. A couple of points. One is the lab, of course, the lab director has solidly supported the founding and launch of the institute by providing us non-research funds, which means we can use them for traveling, for making a pitch to a potential funder. But we cannot do research with it because it's not a DOE fund which we can use for research. That's the way the lab rules. So he's provided us with kind of what do you call walk around money, right? Now it's our job. Now it's our job to get research money, and that's what we'll set out to do. Last year we applied. Last year was 2011. We applied for funding to take the Berkeley Darfur stove to Ethiopia. We applied for that funding to USAID. We have been told that we won that proposal. We asked for $1.5 million spread over 3 years to modify the Berkeley Darfur stove to Ethiopia, to set up a supply chain, to set up assembly workshops and production workshops in Ethiopia to make it indigenous. So for example, I mean, the money is not here, so when it does arrive, that will be the first time that you would really have some research money under the LIGTT Institute umbrella. But that's just a small beginning.
This is on? Yeah. Great idea. I wish you much success. And I know the strategy is being developed and you haven't finalized it, but is this is this only a technology-driven type of assistance where you're looking for new technologies to help people in these other countries? Or are you looking at sort of other support activities in terms of, let's say, helping people develop programs and policies in those countries, to do some analysis in those countries? Or is it more of, again, focusing on let's get a good technology to help these countries?
I think you've answered the question yourself, which is technology unto itself doesn't do a whole lot. It has to be accompanied by something, whether it's the community that uses it in a particular way, whether it's capacity building in the ecosystem, whether it's policy. It's unclear. You know, the exact answer depends on the exact problem, but without question, the mistake we want to avoid is a hammer looking for a nail and assuming that technology fixes everything. Nishma and Roger, Francis, do you want to add to that?
Yeah, I think we're not under any illusion that technology alone can solve all of the world's problems, and that's not what we're out to do. But technology can perhaps mitigate some problems, and so it's worth going after that. You know, in addition to technology, of course, there's political, economic, a lot of other factors involved. But you know, here at Berkeley Lab, we do science, we do technology, and just as looking at the problems in the developed world, we don't expect that technology is going to solve all of our problems here in the United States, for example, but still we work on technology questions because we expect that they can solve some of the problems here in the US. And I think we should put the same filter on work done in the developing world as well. Yes, technology is not going to solve all the problems, but it can solve some, and that makes it worthwhile.
And the thing I'd like to add to that is I heard a really profound but simple quote a few months back when I was out on work. This elderly man basically said, "We've got to want it more than you." Right? If there isn't demand for it, it won't work.
Yes. I just want to say this is hugely exciting. I've been working in the Global South for 28 years now, and this is quite incredible. And I'm a cultural anthropologist, so any commendation to scientists, you have to sort of pull it out of me. This is fantastic. I was also given what I heard. I had a question so one is you develop the technology, and wherever there's need for it, it can travel there. But are you also identifying countries and therefore in those countries partners? Because there's a lot of interface work that between the technology and getting to the people that has to be worked out, and what your plans are for some of that.
So far we've looked all over the world, and the world's our oyster, right? But I think we've zoomed in mostly into sub-Saharan Africa and South Asia as the first kind of regional focuses that we're going to go after. And so we're also looking at partners specifically that work in those areas, and of course at global partners who may also do work internationally but do very hands-on work in those areas.
I mean, it's obvious we don't have boots on the ground, so we have to work with people who have boots on the ground, and those are usually going to be our partner institutions.
So I have a question about the business side of things. This ARPA-E thing is out there, and we're basically told if you don't have IP, it's really not of any value. You need to generate IP with the ARPA-E projects. But I don't get the sense that's the same here. Am I right? Or if I'm wrong, or if it's not, I'm wondering why do you not have to have IP in this case? I'm just curious about the whole question.
We didn't quite make a decision one way or the other whether we have to have an IP or not, first of all, okay? We do believe that if it's going to go to scale, for example, my understanding is the solar suitcase, the WeCare solar suitcase that you saw, is not our project. We are just helping them, but they need 300,000 of them in sub-Saharan Africa. The challenge is, are you going to get 300,000 of them and give them away on charity? Is there that much charity money available, or is there a business model? And then if there is a business model somehow to recover costs, maybe even eventually tapping into, I don't know what, carbon credits, tapping into CSR funds or something, or maybe government budgets. If there's a business model, does the IP allow the business model to be successful? Does that make a difference to the business model or not? Sometimes it doesn't really matter. All that matters is you have a clear business model of how it goes to scale, and that's totally adequate. But if it is going to go to scale, only then it is worthwhile doing this. I mean, the slide that Shashi put up saying, it's got to impact at least 10 million people. You're not trying to do something boutique in a small corner, which just will potentially help only a couple of hundred people. Then it's not worth the little effort that we have, because we are only a 4,000 staff lab, right? And we are saying we are trying to help people at the bottom of the economic pyramid who make less than $1.50 a day, and that is 2 billion people. So unless we are ambitious about going to scale, and unless we keep that in the back of our mind right from the get-go, not just technology and invention and innovation, but also working with the right institutions and a business model and a scale-up, we are just going to be not even a drop in the bucket, and we hope to be a lot more than a drop in the bucket.
To add to that, there are two separate questions. The first and most important one is there demand? Is there a market? The second is, does that market, do those customers have the means to afford this? That second problem will have various solutions. So for instance, if it's an institutional buyer, the WeCare Solar, for instance, it's not meant to be for the consumer, it's meant to be for the clinic, which means that the price point can be higher. Of course, a lot of these clinics don't have that much revenue, so we still have to figure out how to get there. But the buyer may be the individual, it may be the government, it may be subsidized by an aid agency, it may be an NGO. So the business model will vary. And the question of IP is central to all of that in a way.
I didn't hear much about. Can you comment on the relationship with governments?
The governments in the countries where we'll work. Again, it will depend on the particular product. If it's something that requires the public infrastructure for dissemination and usage, yeah. But it will again vary by the particular product. So if it's something, let's say we're doing, I'll make up an example. This is not a real example. Let's say we're doing some sort of biometric device for TB, right? A lot of TB work gets done through public facilities. So in that case, it only makes sense to work through the existing infrastructure. In other cases, it's very retail.
I think a lot of it's sort of going to be, which particular country and what are the situation that's going on there. I do want to call out. Notice that Dr. Laura Stochel is out there in the audience. I want to acknowledge her and thank her. Some of the conversations that she's begun have been at ministerial levels in particular countries. And so that's actually a really good way to really get ownership, because when if they really grab that at a ministerial level, they're really committed to it. They're really going to make it work. And so when you have those contacts, which Laura is managing to develop, those really we really think that's going to make it much easier, because they really now have a vested interest in it being successful.
A real basic related to your issue about taking to scale. I am really pleased with this program. Could you amplify a little bit more on how you might truly leverage, engage, and market all of those that are already engaged in one way or another? I'm talking foreign aid for either our country, UNESCO, World Health, or United Nations organization trying to bring technology to scale similar to what we're doing here. How do you market those agencies, because we're so small, to get some of their funding to see the value we bring? And that's a big job, because there's a lot of people with a lot of money thinking they're helping, and they may not be. They may be giving money to corrupt governments that never reaches the people or the areas we would like. So could you amplify a little bit on how you go from here to scale and create those partnerships where you will be wishing you had more staff because you have so many people beating down your door?
It's a great question, and one that's central to whether or not we'll succeed. There is no way we'll sit on this lovely hill in Berkeley and solve the problem. It will require a lot of relationships, dozens, possibly 100 relationships with 100 organizations around the world. Whether it's a UN agency, whether it's an NGO, whether it's a government, again, it will vary, but you're absolutely right. The secret to success will be leverage, and will be a network of organizations that can fit every part of this value chain.
I just want to add that we see increasing recognition in aid agencies, including State Department and USAID, that in the United States, we have not really tapped into our core strength of technology, innovation, and invention. We've been kind of directly giving aid to build routine, standard infrastructure, maybe build roads, maybe build some water pipe, or give away blankets and things like that. So now we see from the leadership of USAID, from Dr. Rajiv Shah, an emphasis to actually begin to invest in technology innovation to advance the goals for which USAID is committed. So that's the call to which we responded, for which we expect to get some support from USAID for stoves for Ethiopia, for example. So that, in some sense, success breeds success. So having gotten somewhere with UV Waterworks, which now serves 5 million people, having got tens of thousands of stoves in Darfur, and we hope soon in Ethiopia, that's the kind of stuff that attracts attention, saying, hey, there is something here that's game-changing. There is something here that really is transformative, that comes out of a good grip on science and engineering, which, of course, we leverage the brand of Lawrence Berkeley National Lab on top of that. So we hope to be successful, and that's what was reflected in the about 50 different interviews that this team carried out before the lab decided to launch the institute. there's tremendous confidence in LBNL's ability to innovate on the cutting edge of technology and science among the people whom they reached out to ask.
So I just wanted to break in real quick. It's a few minutes past 3, so amnesty for anybody who wants to leave, but I think a lot of us still want to stick around and keep talking, so we'll keep going with questions, but if you do need to leave, feel free.
Is there any plan, learning from other organization models, whatever they have tried scientifically, and some are failed and some have succeeded also, because when you do experiment, because of some social or cultural reason, it can fail what social scientists today. So is there any plan to take care of failures of other organizations as well?
Well, Roger's worked for a dozen years in refugee camps, thinking of some of these issues, and Reshma's worked a fair bit in urban slums. So what's your take on that?
Well, certainly learning from past successes and failures is going to be critical, and as the Light Institute continues forward and gets involved in various projects, then we'll learn from our own failures and successes, and even before then, we're looking around and seeing what has worked in the past, what hasn't worked in the past, and how to build on those successes, and especially engaging with local partners is going to be critical, because they know the real questions that need to be answered, and we can work with them to develop new answers that end up successful.
If I can just add to that, one of the biggest lessons we learned was actually in the planning phase of this institute, for the incubation of this institute, was that when we looked at some benchmark organizations across the world and across the US, we found that many of them were tackling the problem, but they were tackling a part of the whole the chain. Some of them were tackling only the entrepreneurship part. Some of them were doing semester-long academic projects where students would go to the field and develop a gizmo. Some of them were working only with technology up, in some Western country, but not thinking too much about the transfer versus transformation of that technology. So we're also hoping to build upon lessons learned from other organizations, as well as what Roger said. So we've started that process already, and we hope to do a lot of learning along the way.
So thank you. This is awesome. So I want to move to the ideas. I mean, I know I like coffee, so I think probably I'll be having a lot of coffee. But what stage of ideas are you looking for? What kind of, there can be some crazy ideas, what if, but I'm sure that you don't have time for all the what ifs. So what stage of ideas are you looking for? And do you have, say 10 grand challenges or 10 challenges that you want to target so that the ideas are focused? Is that something you're working on, or is that something you already have?
Absolutely. So we'll probably have something like 5 pillars, right? And we need to do some thinking about what those will be. And that will add a fair bit of focus. So for instance, and not clear this will necessarily be one of them, take water access and purification. You can't imagine any path to these problems without that. Right? There'll be a few more of those, so that will immediately focus it. The other element of it is it has to be real within 5 to 7 years. Now, granted, some of these will be fairly upstream, and things don't happen overnight, but we have to be able to see the light at the end of the tunnel.
For products that would potentially have a retail market, what types of models or plans do you have for partnering with the private sector?
Great question. Going back to what I said a couple minutes back, so you'll have products that will be relevant to the retail market, so to speak, to individual consumers. We have to be very thoughtful about the business model here, right? So for instance, in some cases, it may make sense to get the initial penetration with not the bottom of the pyramid, but a couple levels up the economic ladder, and use that to subsidize, right? So it definitely is not charitable giveaway. But given that it's trying to solve the bottom of the pyramid problem, we just have to figure out how to make the economics work for that. right? And there really isn't enough money in the world to make it sustainable using philanthropic dollars. So that will be, in addition to the scientific and the technological challenges, that will be the other element of it. We just, and there is no easy answer. We just have to be very smart about it as we move forward.
Come to the smartest group of people.
Yeah.
Next, would you foresee licensing or giving away the IP rights so that commercial firms can produce these products, or will you look to be highly involved in managing and overseeing the manufacturing and distribution and business model for these?
We had a long debate about this yesterday.
That's an easy one. The question is, to what extent would LBNL would be involved in manufacturing, management, marketing, sales, dissemination? By our charter, we are an LBNL institution. We are within LBNL, wholly, entirely owned by LBNL. LBNL cannot, by its charter, engage in manufacturing, marketing, and business. Okay? Our job is innovate, publish, maybe produce IP and license it, but that's where the boundary fence is. Okay? So we would work with other entities outside the fence in that sense to take it to manufacture, scale, market, and so on, and we would assist them. But as a part of Lawrence Berkeley Lab, which is University of California, operated for Department of Energy, we cannot participate in any of the rest of that scale-up process. Though our eye is always going to be on that process, saying make it successful. Do what it takes to make it successful.
And if somebody is going to make money off of it, so be it.
So be it. Yep. All power to them. Great. Yeah.
Yeah, I'm doing some work with Philips Lighting on some of the more high-tech stuff that I do, but at the same time, they also manufacture various solutions for the developing world. And so I would be exploiting those contacts as much as I can, because they're the ones who are going to make this stuff. We're not going to be sitting there making it. It's going to be the companies that are going to make this. So, but what we need to do is to make sure that those products are really reliable and sustainable, and that there's a way to one can maintain those products in life, because I'm quite nervous about these kinds of things. I mean, yeah, you buy them for $14 and you get what you pay for. And I'm quite nervous about us providing things like this and they die, out in the field. And it's not, you can't go to the 7-Eleven and pick up new batteries there. And so there is some targeted work that needs to go into. Is there intellectual property? To be honest, I don't care. My own thought.
Sometimes I should add, sometimes the businesses that want to take the product to market want it to be protected with IP, because that protects them from the sharks who would otherwise simply come in and replicate the device, undercut them at a loss, drive them out of business, and then take over the market. With IP, they are able to protect their entry in the market.
I think you have both kinds of IP out here, intellectual property and impact in populations.
Sorry.
Perfect example is Jen Keystone.
No. You need to be in the mic and we have somebody.
Yeah, she's giving you my mic, yeah.
Yeah, but we have.
But in the meanwhile, yes.
I have 3 questions. The first one is, what I understand why the focus is on the urban poor and not rural poor, and that distributed technology solutions are the answer for immediate problems. Do you think that distributed solutions can slow down or affect the development of the networks, for example, for energy or water in the cities? The second is about partnership with local institutions. So do you plan to assist the creation of institutes locally, discussing with the government? And the third one is, what's the role of the social sciences in the first deployment and study of the needs, meaning how many social scientists will travel with you first?
So, do you want to take it on?
Sure. The first question was about this decision to focus on urban versus rural. It's not exclusive, right? Certainly the majority of the poor live in villages, so we'll be opportunistic about that. It's just that there is this urban problem that's growing, and it comes with a whole host of social ills that can be extremely destabilizing. And there have been decades of thinking on rural problems, not a whole lot on urban, right? So that's the reason for the urgency around that, but it's definitely not exclusive. Will some of these things get in the way of other development? Well, if it's demand driven, there are two answers to that. First of all, if it's demand driven, it'll go where it'll go, right? I don't think we'll fundamentally alter the development of something structural. There will always be unintended consequences, right? And we just have to be very careful about what those are. So for instance, the thing to avoid, one example of something to avoid is if through dissemination of a subsidized technology, we're driving out a local organization out of business. That sort of stuff we have to be extremely careful about, right? And that also gets to your third question about the local ecosystem. We have to be extremely aware of the local ecosystem, what's going on, who are the potential partners. I mean, in principle, we need to hand off. Actually, in practice, we need to hand off at some point, and ideally, we hand off to a local organization. So, to do this absent really thorough knowledge of that ecosystem would be a mistake.
I just want to add, we haven't identified what partner institutions we are working with or we will be working with, but that's critically important because every partner institutions you work with brings with it an overhead on the organization. So if we end up having 24 partner institutions or 100 partner institutions, that overhead alone will kill us, right? Given the size of the institute. So for the LIGTT Institute to work, we need to be very selective and careful about whom we work and limit that, given that we are such a small organization. And we can't simply carry the transactional cost of dealing with 100 partners, all of whom will demand attention and 5 emails a month. I mean, that alone will wipe us out. So we got to be careful with that.
I think we just contradicted each other, but that's okay.
That's okay, but I'm worried about the transactional cost, and that's all. So there's obviously issues to be still sorted out.
Just another comment. One of your questions was about social scientists on the team. And yeah, the teams are going to, by necessity, be multidisciplinary. And so I'm sure in each project will be case-specific. There would be social scientists, economists, engineers, scientists, anthropologists, as needed to really understand the issues and meet those needs.
One plea, I would urge you very much to also consider the rural areas because, as Dr. Bullerswar said, that there have been solutions that have been developed for rural poverty, but they have largely also been ineffective. And it's because they've been ineffective that it's driven the population from rural areas to urban areas. It'll be very important to think about that. The second is a question that technology at times has also been delivered to, for example, urban or rural areas, but its lack of training, its lack of sort of the cultural interface with the community, that's not allowed it to be successful. And I imagine your clients, so to speak, disproportionately will also be women in these contexts. And I'm wondering if you're going to pay attention to, or if you have a plan, and I'd be very curious to hear, sort of who your local partners are and how you work with them so they work with the women, that transfer of knowledge and power, so to speak, what your plans are for that.
Yes.
Depends on the technology, depends on the context. When we work in Darfur, we work with Oxfam America, we work with Sustainable Action Group, which is a local Darfuri NGO for assembly of the stoves. Is the Sustainable Action Group that takes the assembled stoves and trains the women. So they are local people and they have been trained by either Oxfam America or us. But unless we do all of this, technology doesn't work in isolation. Yeah. I think we'll take 3 more questions and stop.
A minute ago, I just wanted to add, I think, a perfect example of technology transfer from this lab is Jay Kiesling's J-Bay artificial virus made in the lab. A local company has been started to market that, and the cost of that virus to treat malaria in Africa is more than like 5 times less than the current cost. So people couldn't afford to get the virus because it was manufactured through a tree bark or sap, very laborious process. Right. Jay in the laboratory with laboratory knowledge and help has been able to do that. There's going to be a huge factor of savings, and I don't know whether this company's nonprofit. I hope it is. Anyway, I'm just saying there's a perfect example at a very large scale of what our biology is doing, let alone what the rest of the science can bring to bear.
Perfect. Agreed. Yes. Jia's done a fantastic job with Artemisen.
One of the really sort of fantastic things actually about working in a place like this is that I've talked with a number of people about some of the problems we're facing with these flashlights and headlights and stuff like that, and I'm amazed at the number of people that I work with every day who have a font of knowledge that's really quite deep and really quite astonishing actually about how you know manufacturing and how you manufacture things in quantity and well and things like that, and it's how batteries work and how to select them, and it's we have a huge a really very rich environment here to choose from, and I think it's that's really helped inspire my thinking a lot too, because you have so many people who are really not just interested in these problems, but really have thought about them and really have some real solid contributions to make.
Hi.
My question, it relates very well to your question 2 questions ago. Do you see value in, and is there a plan for some kind of in-residence portion of the Institute where people from these communities would be coming here, spending time with us, participating in the design process?
Yes.
Okay.
We absolutely, definitely will have exchange programs with our partners.
My question is, what is the correct order and role of the profit motive? And I'm going to abstract here to biofuels, the profit motive in the global energy, climate, population challenges that we face. Okay, for example, the EU policy for biofuels, lots of land use change in Africa going on, disempowerment of women it's been correlated with. We all know what that does to population challenges. So this lab is involved in a lot of biofuel research. So there's almost this like schizophrenic, I would hate to say, approach to the problem. And so holistically, what is the proper order for the profit motive in the global scheme of things?
Let's unpack that a little bit. There is profit as a motive, which invariably a lot of the organizations we work with will have, and then there is profit as a necessary enabler of a sustainable business model. And there is no single right answer to that, and part of what we have to do is unpack that one problem at a time. It also goes back to the question of unintended consequences, right? So again, there is no blanket answer, and we just have to be very, very thoughtful about unpacking that for each problem we take on. I don't know if that answers your question.
Let me another way to answer this, another way to say the same thing is, there is no centralized top-down wisdom anywhere on the planet that's going to say this is the way you are going to get to sustainability. So we are all trying to do our little pieces, and we figure it out as we go, rather than get paralyzed by fear that we don't have the whole answer. Because the only other solution is paralysis from lack of complete top-down knowledge, or that level of wisdom and power. And that level of power would be really dangerous for anybody to have anyways. I think that was the third question, so thank you very much. Really appreciate it.
Thank you.